So there's two main reasons that people have dark circles under their eyes. The first one is when they have volume loss in the area of the tear troughs. Now, and what that does is create an indentation in this area and the shadow falls into it and it looks like a dark circle under the eyes. That kind of volume loss can be caused by a variety of factors. Most of the time, though, it's genetic, and if you look, your father or mother has that kind of thing, and sometimes you're also programmed to have that kind of thing as you get older. And the other factor in that, of course, is time, is age. And as you get older, that kind of volume loss increases and you get deeper indentations. Sleep is a factor, of course. Your overall health is a factor. And all these things play into what the appearance of those dark circles are. The other component to dark circles under the eyes is the color of the skin in the tear trough area. And a lot of the time, also for genetic reasons, people have darker skin in the lower eyelid than they do in the cheek. And it sets up a contrast and it sets up the appearance of dark circles under the eyes. Now, we can do more for the first issue than we can for the second. For the indentations that we see, I found that Restylane and Radius in combination do a really, really good job in filling in that indentation and really smoothing over that area of the face. The goal of the procedure is to have a flawless contour under the eyes and into the cheek. Much of the time, the indentation in the tear trough area continues into the cheek, and there's also some volume loss in the front cheek area. This is corrected with Radius filling in this area, and you have to go quite deep, but the result is very natural in appearance. In the actual area of the tear trough, I like to use Restylane, very small amounts, right into that indentation. If done carefully, Restylane can replace the volume that's been lost and give that kind of flawless contour underneath the eye. I found that when using fillers in this area underneath the eye, there is an increased risk for bruising, and that's just something that we need to make sure that's understood prior to the procedure. A lot of times patients will schedule it so that they don't have social obligations around the time of the procedure, just in case there's a bruise. It's not often that you get bruising, but sometimes it does happen. In terms of duration, I find that Radius in the cheek lasts for about a year, but the good news is that Restylane in the tear trough area, right in here, does tend to last for 2 years and sometimes even 3 years. When I fill the area underneath the eyes, it has to be so exact and so precise that I like to bring people back 2 or 3 weeks later, take a look at it, make sure everything is symmetrical, make sure there's no bumps or no residual indentation. And if we need to do a touch-up procedure, that's when I would do that.